Association for having me here tonight. So as Ryan just said, I am a clinical health psychologist living in the Chicago area. My specialty is working with adults living with chronic medical illness. My super secret specialty is working with adults living with rare and genetic diseases and the specific psychosocial issues that come along with that. I also just want to throw in there that I am also a rare disease patient myself. I was diagnosed with Gaucher's disease type 1 about 23 years ago, and it is the source of and the drive behind what I do, having been a patient myself for more than 20 years, and where my passion for this topic and for my own patients comes from. And so I'm going to try to share my screen here and make sure that that works. And here we are. Okay. If you cannot see that, please let me know.
I can see that perfectly.
Okay, great. All right. So today I'd like to talk a little bit about the small but significant literature that does exist out there in the academic world of evidence-based studies, academic research having to do with the psychological and social issues that come along specifically with living with a rare disease that are different from other commonly known chronic medical issues like cancer, HIV, or diabetes. And there are some issues that are very specific to rare disease, as we're going to talk about tonight. And I think this is important because as patients, we often have to be our own advocates and very informed consumers. And I think that some of this information is going to feel like common sense, but elevated to a level where we can actually point to evidence stating that this is actually many people's experiences across many different types of rare diseases in many areas of the world. And so briefly, we're going to talk about, I'm going to review about half a dozen articles, just kind of give a summary of those articles, share what they have found. We're going to talk about what then is different about being a zebra, being a rare disease patient, psychosocially speaking, and what are some future directions for treatment and resources for support and awareness. Okay, so in this first article, this is kind of a good general article to start with. This was published very recently in 2019 in the Journal of Health Psychology. They actually looked at quite a large number of patients here, more than 1,100 patients. And the purpose of this article was to look at, in rare disease patients' own words, what, if any, challenges are most prevalent across different rare disease diagnoses that patients themselves identify. And so in no particular order, patients identified symptoms that are specific to their diagnosis as one of the main challenges that they experience. The way that those symptoms may limit any activities that they have or want to participate in. Specific challenges related to various types of treatments that they receive. The levels of uncertainty that can come along with living with a rare disease from many different sectors. We are going to talk about this in some of the future slides in a little more detail. And finally, the difficulty at times when living with a rare disease of finding or accessing companionship, specifically peer support, where the peers may have their exact diagnosis or at least a similar enough experience with rare disease to be considered a peer. And so generally speaking, these were some of the main categories of challenges that rare disease patients identified across multiple different diagnoses. So the article concluded that improved medical care, specifically targeting ways to reduce activity limitations was potentially very important. This is different than just improved medical care in general. We could all use improved medical care in general, but the care to be more targeted towards solution focused type strategies was what was a little bit different about this finding. Increased overall awareness of many of the rare diseases of the participants in this study, increased social support. And again, this is not just general social support of any old family or friend. This article specifically found that a peer-informed support of people that actually were peers in this context was very important. And greater access for individuals to relevant information for rare diseases, which can obviously be quite a challenge when not everybody, very few physicians out there may be studying this disease. But when those things were not there, they were identified as one of the significant challenges that people face when living with a rare disease. Let me just pause here for a second and acknowledge that these slides are very information heavy, and I apologize for that. I purposefully included as much information as I could to summarize these articles, since I know that people may be able to access this webinar going forward. And these were very complex articles, and I wanted to try to summarize them, but with at least some detail. So I do apologize for the fact that these are a little bit busy. So this next article looks at a very important concept in health psychology, which is health-related quality of life. And you may have heard of quality of life. This measure actually looks at quality of life specifically when somebody is living with medical issues. And so just as an example, the profile that they used here looks at things like anxiety, depression, fatigue, the interference of pain in daily life, the person's level of physical functioning, and their ability to participate in social roles and activities. And so how these independent domains are affected by someone's health issues is what makes this health-related quality of life. And so they also looked at quite a large number of participants, about 1,200 across multiple diagnoses. And they found that the health-related quality of life scores were significantly poorer for rare diseases than when compared to not only just the other people with more common chronic conditions like cancer or heart disease, but with the US population in general, significantly poor based on these different domains. They found that people with rare systemic, rheumatological, neurological, and immune diseases, as opposed to other types of rare diseases, rated the lowest health-related quality of life on the measures that they completed. This study found that health-related quality of life was lower if the person had more than one rare disease. So this had kind of an additive effect. If the person had more than one rare diagnosis, their health-related quality of score tended to be even lower than if people that just had one. They found that income was related to health-related quality of life. If somebody, not surprisingly, was able to work, had better health insurance, and better access to medical care, their HRQL score was higher. So this really speaks to how other factors impact something like quality of life beyond just the physical symptoms that somebody is experiencing. For reasons that weren't fully explained in the study, they found that females tended to have lower scores than males, and older patients were also had likely to have lower health-related quality of life. That being said, some of the individual scores were actually a little bit lower for some of the older folks, and that may be because of expectations that older folks are, just in general expecting to feel those things. So that result was a little bit mixed. but generally speaking, older adults reported lower health-related quality of life scores. If a person is currently symptomatic or was currently symptomatic, their score was a little bit lower. And this was a very interesting finding, especially with rare diseases. If a person had a formal diagnosis, their score tended to be a little bit higher than those of us out there that are currently living with rare symptoms but have no name to put on them. So having a name and having a diagnosis in the rare disease world can potentially contribute to feeling a little bit better and feeling like you have a little bit better quality of life, which is a really interesting finding. And so generally they found that there is a significant difference in reported health-related quality of life between people with rare diseases and people with more common chronic conditions, as well as the general population in the US. If I'm going too fast or anybody has any questions, please feel free to stop me at any time. I know it's a lot of information. Okay. So now those of us in this community know how often we experience interactions with the medical community. And so a couple of studies that are out there looking at rare disease psychological aspects actually do focus on what's it like for a rare disease patient to look for medical care, interact with their providers. What's going on with that and how does that affect rare disease patients? Excuse me. And so this study in the Journal of Health Policy in 2012, the purpose was to really get a better understanding of the types of interactions that rare disease patients have with their physicians and what is going on there that's positive or negative that might help us understand the rare experience a little bit further. And so basically they found that there was a conflict between rare disease patients needing to be their own advocate, needing to be more assertive in their medical care, needing to push for certain solutions or ask a lot of questions above and beyond a patient with a more chronic medical issue or a more run-of-the-mill medical encounter. And that this led to what they termed role discrepancies. Which may be that in this role as assertive advocating patients, these rare disease patients came across very often physicians who may have been lacking information about their symptoms or diagnosis, had insufficient information or somewhat ambiguous knowledge, and that physicians often needed to adjust their identity as the authoritative figure when faced with the assertiveness and increased engagement of a rare disease patient. This may have led to dilemmas in interactions with medical providers. I feel a lot of you out there nodding along. This is a very common experience for rare disease patients. And so patients with rare diseases may experience dilemmas when approaching their physicians, which leads to a certain type of distress and anxiety when they need help. However, may actually be the expert in this role rather than the physician, and may need to be the one providing the information to their doctor and the possible treatment options to their doctor. And that this presented a conflict for many rare disease patients, especially in the beginning of their care journey, and having to try to navigate this role discrepancy different than the traditional expectations of the patient and the physician encounter. Along with this, rare disease patients identified how empathetic the doctor was and the ability of a doctor to cope with potentially a poor prognosis for the patient is really important. It could be very distressful if there was a poor outcome that was possible with a diagnosis, including the potential of death. If the physician was not comfortable discussing it with the patient, that also contributed to distress for the rare disease patient in these encounters. And so this study concluded that the provider, the physician's ability to acknowledge the active role that a rare disease patient oftentimes must have as an informed and involved and interactive partner was really important in mitigating the stress that the patient did or did not feel when going into the medical environment. Okay, so this was a really interesting study, if I can go back, that required 2 slides. And related to the last study about the medical encounter, this actually went a little bit further and a very interesting perspective. And so this study, they wanted to look at how individuals rated the specific quality of their disease being rare, how that was attributed to any difficulties that they felt they experienced in their daily life. They again looked at a few different rare disease diagnoses. And what they found was that in this study, surprisingly, these participants did not identify the rarity of their disease as being a cause of any special difficulties. However, there's a big qualification here. They did not rate the rarity of disease as being any special problem if they felt like their medical care was being handled adequately. And so if you think about the last slide that we just talked about, this really takes that a step further. So how we identify being rare as a special attribute for any difficulties that patients might experience really has some connection to the quality and appropriateness of medical care that patients feel they are receiving. And so if we look at that a little bit more, break it down just a little bit more specifically, there were some key issues that were identified under appropriate and good medical care as part of that qualification. And so when patients experience delayed diagnosis, the more the person's diagnosis was delayed, the more a person identified being rare as a specific problem contributing to their distress and difficulties in daily life. There were some critical medical attitudes that came out of this particular finding. So particularly if patients felt like their health professionals refused, again, to seek assistance to remedy knowledge limits or diagnosed or disclosed their diagnosis in a poor fashion. There was incomplete or incorrect information. There was minimizing of the seriousness of a person's symptoms or diagnosis, or generally a poor bedside manner. That the delayed diagnosis was even more of a stressor, and being rare was identified as more of a specific, unique part of the stress that a person was feeling at that time. So related to that, it came out in the study that rare disease patients felt like the information that physicians were providing should help patients reach goals. It should be action-oriented and ability-related. In other words, how can we help you live longer? How can we help you be more mobile? What will I be able to do versus how it's often communicated the limitations that our illness will potentially inflict upon somebody. So rare disease patients said that they really were looking for not just information, but guidance. And that when that was provided by their physicians, it minimized the idea that being rare was the problem, was the bigger problem in and of itself. When there was insufficient treatment, that contributed to the rare disease descriptor being identified as more of a stressor, and the more isolated that a person felt, which is something we'll talk about again in a few moments, the more isolated a person felt, which was sometimes exacerbated by these medical encounters, the more likely they were to attribute their stress to, at least in part, being due to being rare. So the conclusion of this very interesting study was that rare disease patients expressed a strong desire to feel morally well treated as a patient, and that this was more important than their specific circumstances from their specific rare disease. Okay. So now we move into some other types of psychological issues that rare disease patients describe. This was a descriptive study that asked people to identify the different areas of their rare disease experience that were affecting their day-to-day mental state. And so as we'll see, and as we're starting to already gather from the slides that we've talked about so far, for rare disease patients, things like healthcare issues with the system and social and economic issues play a pretty large part in psychosocial stressors that rare disease patients experience, even more so than perhaps other chronic illnesses. And that's because of the lack of knowledge and the unique role that rare disease patients are forced to play by being their own advocates, as we've talked about here a little bit. So in this study, there were 6 key areas that were connected to patients' mental state. Healthcare problems, uncertainty due to delayed diagnosis and treatment again, misdiagnoses, which can be very common in rare disease patients, the difficulty in finding an appropriate specialist, very difficult when one has a rare disease and maybe a handful of doctors in the world can pronounce it and spell it, let alone treat it. Social and economic problems. So if a person was unable to work, if the treatment is very expensive and contributes to lower socioeconomic status, there were feelings of fear, anxiety, anger at their circumstances and at the system, feelings of blame for the perceived people involved in creating this system. It can lead to feelings of low self-esteem and sometimes hopelessness. In this study, rare disease patients also identified family conditions as a contributor to different psychological distress that they may feel at any time. So there, in particular, were feelings identified like shame, and shame is a very specific kind of feeling. Shame speaks to somebody feeling like there's something wrong with them specifically, versus guilt, which is feeling bad about circumstances. Shame speaks about low self-esteem and feeling bad about oneself as a person. Anger at themselves, at family members, hopelessness, again, due to a perceived lack of sufficient support from relatives. This can play a role in the dynamic that rare disease patients have with their caregivers, and how that specific relationship plays out. Sometimes people with rare diseases are stigmatized and categorized as being hypochondriacs or malingerers. In other words, people that are not really sick and trying to get something from their symptoms, because there's so little understanding of so many rare disease diagnoses, and it may be difficult to even get the appropriate diagnosis. Being diagnosed or being thought of as a hypochondriac or malingerer is actually a little more common than in people with more commonly known rare diseases, where family members can say, oh, I've heard of that. I know that that is hard. So that can be a bit of a difference. Rare disease patients identified decreased friendships and ability to participate in social activities, as a significant part of their psychological distress, that social isolation that we talked about. So it's not only social isolation because of their inability to access peer support in their disease category, but also social isolation for reasons of illness and physical inability to actually access their non-medical peer-related social networks. And this can lead to things like depression and hopelessness. Many symptoms that people experience with their illnesses do actually interfere with sexual functioning, with comfort with physical appearance. There may be physical changes that occur due to the illness or surgical procedures, treatments in and of themselves, and these can affect their partnerships, their romantic relationships, things like self-esteem, pain, difficulty sleeping, and difficulty communicating these issues to their partner. And finally, just a general sense of elevated mental vulnerability. So what was interesting about this last point here was that prior psychiatric diagnoses were found to not be required. So in other words, for any of these things that I just talked about to occur, it did not mean that these folks most of the time had prior mental health diagnoses. Many of the people in this study were seemingly mentally healthy with no prior mental health issues before their medical diagnosis. And so the point of this finding was to demonstrate that many of these psychological issues were secondary to the medical issues that somebody has. And this is something that has a lot of back and forth for sure in the health psychology world of kind of the chicken and the egg, what comes first. Was the person depressed because they were in pain, or are they in pain because they're depressed? This comes up a lot. And what this point here is saying is that according to this study, the medical issues came first for most participants, and the psychological issues came second. So looking just very specifically at a couple of numbers here, in this study, they looked specifically at rates of depression and anxiety in people with rare chronic diseases. This is again from 2019, very recent study. So in this study with about 300 participants across 79 rare disease diagnoses, they found that 42% could be found to have moderate or severe depression. That is a very high number, and it's an important finding. And almost a quarter of rare disease patients in this study were found to have moderate or severe anxiety, which was often comorbid with the depression. So this might not be 42% plus 23%. There may be some intermingling in here, and probably is. But these are very high numbers when compared to the general population, and definitely warrant some specific attention to making sure that those living with rare diseases are receiving appropriate mental health support in order to help out with these symptoms. One thing that was interesting also about this study was they found that the invisibility of a disease was particularly stressful. So we know for sure that there is stigma and certain distress related to having a visible physical issue. There are also specific stigmas associated with having an invisible illness. For those of you out there familiar with "but you don't look sick," this is something that people that live in this world are very familiar with. The conflict of feeling terrible, being in pain and feeling terrible internally, but looking fine to everybody else around you. And there is a disconnect and a difficulty for people to sometimes understand what people with invisible illnesses are dealing with. And people are sometimes outright just not believed for their symptoms because of that. They found that cardiac involvement was linked to increased anxiety and depression. This is not just specific to rare disease. This is in general There's very strong evidence that depression and cardiac issues are interlinked in and outside of the rare disease world. And so this really speaks to the high rate of depression and anxiety that people with rare diseases are experiencing. Okay, and so I think this is the last study, yes. Okay, and so in this study, this was a literature review. So this was a study that reviewed a lot of other studies and put together those conclusions. So in this literature review, they looked at 21 other studies, including one or two of the ones that I just talked about individually above. And they looked at the results of all 21 studies to come up with these conclusions. So this systematic review is a pretty good resource here for information about psychological issues and living rare. And so they found that there were 3 different types of consequences of living with a rare disease diagnosis that patients across all of these studies identified in multiple occasions and multiple contexts. So the 3 categories were physical limitations, things like pain issues, difficulty sleeping, dietary restrictions related to the illness itself or as part of the treatment process for helping to mitigate their symptoms. So, for example, if somebody has PKU, which is a rare disease, phenylketonuria, there are very significant daily dietary restrictions that they have to deal with on a regular basis, very restrictive, and require a lot of attention and organization. And so this is the type of thing that can also contribute to distress. If the person's physical limitations impacted their ability to work or pursue education and also participate in their family in their typical role. Physical limitations was number 1. Number 2 was psychological impact overall. So this included, again, across all of these studies, rare disease patients identified not feeling potentially understood by those around them, family, friends, medical providers, a great sense of uncertainty about the future, how they're going to feel, what their prognosis was, will they be able to work, what will their family life look like, what will their romantic life look like. Psychological impact due to not having enough or appropriate medical information in finding appropriate medical care, and also in the grief and loss that can occur with a medical diagnosis. And I do use the word grief specifically because for many people with rare diseases and chronic illnesses in general, this can feel like a grief process, only maybe even a little bit different because with exacerbations and remissions of illness, the grief process can seem to go on and on. And so that can, of course, have a deep psychological impact on someone experiencing that. The last consequence category here was actually a little bit of fresh air, which was that across all of these 21 studies, many participants also identified positive emotions from living with a rare disease. Many folks expressed gratefulness for their treatment when it was available. Some folks expressed positive thoughts about their medical condition itself. They found potential for growth, to become a more complete person. They expressed gratefulness for things that they felt that their illness had taught them, ways that it changed their priorities and philosophies on life, and the things that they chose to focus on in their day-to-day experience. And many, many folks expressed appreciation for their caregivers. There were some social aspects that were identified across all these 21 studies, specifically what to tell other people in their life, friends, family, work folks, how to tell them and when to tell them. Many of the participants in these studies identified experiencing stigma for their diagnosis, visible or invisible, feeling marginalized and stigmatized for being somebody identified as a sick person. Many people identified the social impact of feeling different, feeling isolated, and wanting to be quote unquote normal or thought of as normal. And again, that challenge of finding appropriate social support, whether it was in general or whether it was peer related in their medical category. And then finally, as we talked about a little bit above, many of these studies found that rare disease patients identified experiences with the healthcare system as a significant psychosocial challenge. The lack of knowledge about rare diagnoses, having to be one's own advocate, having to wade through physicians of various levels of competence, just the significant amount of contact with the healthcare system that rare disease patients have above and beyond other folks. This is even above and beyond people with other more commonly known chronic medical conditions. Sometimes people with rare diseases have even more contact with the healthcare system because they are trying to seek the right care and treatment. They may be involved in studies and other unique things that come along with the rare disease experience. And finally, as having to be their own advocate, rare disease patients often have to educate themselves and do their own research to be expert patients, if you will. And so they are, again, coming in more and more contact with the medical system in lots of different ways. Whew, okay, that was a lot of information. Again, if anybody has any specific questions about those, I'm happy to go back and talk about those if you have them. So we talk about living rare, and as many of you know, the zebra has become kind of the mascot of the rare disease community. But I have to tell you that in my experience as both a patient and a clinician, I feel like living with a rare disease involves a lot of gray areas in between those black and white stripes. And so here are some of the areas that living rare involves that can be very gray, very amorphous and vague and hard to predict and understand. So folks living with rare diseases struggle with if they will find an accurate diagnosis, if you will be believed for your symptoms, if you will find appropriate medical care, how you're going to feel tonight, tomorrow, next week, next year. If you can explain how you feel to the people in your lives, if there's a treatment, if anyone can pronounce your disease or spell it, always an interesting challenge. If you will find appropriate insurance that will cover your costs. It can be very gray to think about the fact that other members of your family, including one's children, might have this same disease, if it will be passed on to your children through for genetic reasons, which can come with its own burden of uncertainty and guilt and shame. For caregivers, there's uncertainty around if your family member will be healthy, if they will be able to work, have a normal life, and if and how your life may also change through this process. And sometimes the gray area is if somebody will be able to live a typical life expectancy, yourself or a child if you are the parent of a rare disease patient. Okay. So all of that, all of these studies that are out there, and as I said, it is a fairly small literature, but what is out there does have a lot of really good information. So to summarize everything that we just talked about, what is different about being a zebra, psychosocially speaking, seems to be an increased risk for depression and anxiety. If you remember those numbers, 42 and 23% depression and anxiety, much, much higher than the general population. I don't get into it in today's presentation, but there is also a literature out there that talks about trauma-like symptoms for patients with chronic medical illnesses. These are things, for example, like Hypervigilance, which occurs in PTSD. If you have a medical condition, you might be very aware of all the physical sensations that you feel in your body, because the last time you felt that sensation, it led to this very serious problem and this hospitalization. And so patients can develop symptoms that are very similar to trauma symptoms like that, for example. Based on the studies that we just talked about, there does seem to be an increased risk for social isolation and stigma in rare disease patients, even more so than in chronic medical conditions. And that some of the significant sources of stress for zebras are actually not illness related. They are things like our experiences with the medical system, extreme financial obstacles due to very expensive treatments, and health insurance issues. On the flip side, there are also some positive things that are different about zebras. In my experience, personally and clinically, I found that zebras seem to be at an increased risk for resilience, perseverance, grit, post-traumatic growth, the ability to grow from difficult experiences, adaptability, increased self-compassion, compassion for your own struggles, and self-esteem due to continually overcoming obstacles, facing them and overcoming them. This can actually lead to increased confidence and self-esteem, even while dealing with those types of issues, as well as an increased ability to find meaning in the illness experience. And by that, I mean taking these difficult experiences and fitting them into your worldview and being able to make them feel meaningful for you and propel you towards the rest of your life, not despite of one's illness, but because of one's illness. Okay, and so going along this theme of finding support, there are some resources out there for people with rare diseases. So I want to make sure to mention those. It's very important for people to find, as those of you know, if you are on the Fabry Association webinar right now, how important and helpful it can be to connect with advocacy groups specific to one's diagnosis. There are also umbrella groups out there that address concerns and are voices for multiple rare disease groups. So they have a bigger voice because they have a bigger platform, such as the National Organization for Rare Diseases here in the US. I believe that's CORD in Canada. Correct me if I'm wrong. There's also here in the US, the EveryLife Foundation and Global Genes. These are just a couple of examples. Utilizing those specialists when you do find them, if they do know your disease and work in your disease area, being able to feel comfortable asking them questions and asking them for resources as well, and referrals to people that they trust to treat your diagnosis. Social media groups with a big double asterisk here. Obviously, I think most of us are pretty media savvy these days. And we know that social media support groups can be a bit of a double-edged sword. There's lots and lots of good information out there, that peer support that one can find if you have a rare disease, but nobody in your city has it. These groups can be extremely helpful and supportive in that way, but we want to be careful that any medical information that we get on these groups, we are bringing to our own specialists and verifying that they are, in fact, correct and relevant to our individual diagnosis experience. Other general groups that provide information out there on living with illnesses or disabilities or rare diseases. The Mighty is an example that they have articles from people all the time, general patients and general people on all of these different areas. Within your medical community, something you may not know is that there exists such a thing, at least here in the US, I don't know what the equivalent is in Canada, of a medical or licensed social worker. Medical social workers are usually social workers that have specific training in medical populations and with illness experiences. So for example, when I worked in a number of different medical hospitals. As a psychologist, I would often refer my patients to our medical social workers, because those folks will be able to provide referrals to things like financial assistance groups and other resources in the community that the patient might find useful, above and beyond even what I might have. So they can be very helpful. Obviously, I believe that health psychologists are very helpful. We are often PhDs. We are PhDs or PsyDs, so doctoral level psychologists who specialize in and have very special training in working with patients with medical issues. This is different than going to a general psychologist, and there is a very specialized knowledge base there. So I do highly recommend that if you can, if you would like to speak to somebody about depression or anxiety or other psychological issues that you're experiencing due to your medical issues, that you try to seek out a clinical health psychologist rather than just a general psychologist, because they will perhaps have more ability to relate to what it is that you are dealing with. And if medication is needed for management of mental health symptoms, a psychiatrist may be appropriate at that time. And so I leave you with this funny day 126. Larry grows suspicious. He's noticed that there may be an intruder among the zebras. So I thank you all very much today for your time and attention. Here is my contact information. If anybody is interested in or has any further questions or would like further information about my presentation today, you can also find me on LinkedIn if you care to do so. And I would love to open it up at this time to any questions that you may have. I think that I went way, way over. So please feel free to ask me any questions that you might have today.
That was a fantastic presentation. Thank you so much. We definitely appreciate having you not only as a professional in your field and as a doctor, but as a patient yourself. I didn't realize you were also a rare disease patient, so I think we can all relate to that here.
Yes.
I'll let, if anyone has any questions, we'll definitely give a few minutes for you guys to just type it in the chat. There's a chat button down at the bottom. Then you can type it out, and then just make sure it says to either everyone, or if you wanted to send it either directly to myself or Dr. Feuer, if you'd rather it be anonymous, you can do that as well. So Dr. Feuer, if you're okay with that, we'll just wait a minute or two just for any questions to be typed out.
Absolutely.
While we're waiting, just a quick announcement. We are having a Canadian Fabre Camp coming up in 2020. That's May 29th to the 31st. And we have our information posted on our website about that. So if you are interested, definitely check it out. And I don't know if you have your chat open or not, Dr. Feuer.
I do.
So you have
Thank you, Julia.
And maybe if you wanted to go back one slide to your contact information, just in case anybody missed that or.
Sure, absolutely.
Yeah. Perfect.
So again, I know this was a lot of information, probably a lot to digest. If you do feel like oh, there's a question here. Okay. Can you help me understand why cardiac patients suffer more depression? Thank you, Donna. So this is an excellent question. I'm not sure that I can adequately explain the underlying biophysiological processes as well as maybe a physician could, but I can tell you that I have worked in several different hospitals where I was attached to cardiovascular ICU units. We're working with patients with cardiovascular issues. And going back to the first hospital that I was in 2012, which was the Cleveland Clinic in South Florida. Since that time, there has just been more and more evidence showing that people with cardiac issues have a higher likelihood to also have depression. And so I want to be very careful here to say that correlation does not equal causation. And what I mean by that is that it's not entirely clear. They're getting closer to maybe having some answers, but it's not entirely clear what comes first. If somebody has cardiac issues, are they then at higher risk for depression due to things like blood flow through the arterial system and into the brain, or does depression affect cardiac issues on an epigenetic level? But they are interrelated. When somebody is diagnosed with cardiac issues, maybe for the first time in their life at say 50, 60 years old, it is more likely that that person also had depression for 10, 20, 30 years than somebody without cardiac issues. So if that kind of explains it a little bit, I'm not sure if that exactly answers your question, Donna. So there's no real direct ability to say one causes the other, but they are for sure connected. Okay. I'm looking at Lori's question. Says, I think where a person's day-to-day functions are affected by cardiac could experience an impact. Absolutely, Lori. So in addition to the potential underlying physiological processes involved, you're absolutely right. Then you have somebody with ongoing chronic medical issues. And so that is obviously going to potentially add another layer of depression and anxiety to maybe what also previously existed. So you're absolutely right. Very good point.
All right. That might be all the questions that we have.
Okay.
Again, thank you so much for your presentation. Like you said, there was a ton of information, but there's definitely, it's nice to have it all laid out so nicely so people can reference it. So again, thank you so much for putting all the time and effort into organizing that so we could see that. So,
Absolutely. My pleasure.
I guess we'll let you go at this point. Thank you for all of your time. I know it takes a lot of time to prepare these type of things. So thank you so much again. I hope you have a great evening.
Thank you. Thank you for having me. Thank you, everyone.
Have a
Have
good
a
night,
great
everyone.
night.
Oh, sorry.
Have a great night. Bye-bye.
You too.